I am here on the invite of the HUCAS team, and I appreciate that, and I thank you for the extension of the invite and for having me here. I serve the private sector in the Kenya Healthcare Federation as the Vice Chair Health Regulations and Quality Standards. And on the side of that, I also run a consulting firm where I serve as the Patient Safety and Quality Improvement Advisor based in Kisumu. So thank you so much. So my role here today is one to just do two things. And we are talking about matters governance within the country, within the healthcare space. So what I'm going to be talking about is centered on the Quality Healthcare and Patient Safety Bill. So by a show of hands, how many of us have not yet had an opportunity to read it? The bill, the draft bill. It's currently in Parliament. How many have not read it? For those of us who are from the country, Kenya, how many have not read it? Okay, good. A number of us. And how many have had an opportunity to read it? Okay. So, read it. For those of us who are from the country, Kenya, how many have not read it? Okay, good. A number of us. And how many have had an opportunity to read it? Okay. So my role here, for those who've read it, I believe and I hope that after the session, I'll make it a little bit more easier for you to go back to it and read it. For those who are yet to read it, I hope after this session, I will inspire interest in you so that you go back and try and read it. Because in our way of doing things back at systems evaluation, we say that when you come across your colleagues, you should be making their work easier, not their work harder. So I'm here to make your work easier with regards to this bill. So basically, that is just an overview of how we'll walk through the slide. I'll not go through each and every step of it because we are going to cover that. So just that brief bio for KHF, the organization where I serve as the Vice Chair, Health Regulations, Quality and Standards Committee. That's the committee on my far right, at the bottom. So we are organized in 6 committees: health regulations, we have HRH, that is human resource for health, we've got health financing, and I think you've seen most of our members engaging government and the private sectors on issues around SHA and SHIF. We have a supply chain committee, and we have a public-private partnership committee. So just an overview. I'm just here to provide insights on what the bill has. And after that, I hope it will inspire some take-home messages and some areas of discussions on how we move forward. So this bill has 9 parts. I've listed 8 parts. The 9th part talks about transitions, issues around transitions. But now on the first part, we'll have preliminaries. It talks about preliminaries. I'll not highlight that, but the main thing about it, the first part, is the definitions. And one of the definitions that comes across from this bill is the definitions of a health facility. So this time round, the bill says that even an ambulance is defined as a health facility. So when we talk about a health facility, an ambulance is a health facility. The laboratory is a health facility, whether it is standalone. If it is integrated within the hospital, now it carries the hospital as the facility. So we'll talk about a little bit on patient rights, the primary, the part 2, the authority and issues that it comes with, part 4 up to part 8. This is what I would really wish that each and every one of us takes home. I've brought it up. I've got 2 takeaways. There's first at the start, and the last slide. Those are my takeaway homes. So this first slide, we call this compliance requirements. For every health facility, and when I speak about health facility, look at that lab that you are a manager of. That's a health facility now. We've defined it as a health facility. So when I mention a health facility, look at that lab that you are handling, the lab you practice in. So every health facility as an enterprise has statutory obligations that it's required to comply with. So the first are issues around patient rights. And these patient rights within this bill are just basically strengthening what the Health Act in 2017 reinforced. So that is not so new. But now it is a matter of obligation, statutory obligation, that as a lab, you must publish your rights, patient rights charter, and it must be known. And I know in the lab, they call it, is it the clinical lab handbook? Yes, something like that. And in most cases within the lab, the handbook is not fairly known even to the clinicians who the lab is serving. Is that so? So that is basically similar to the patient rights charter. And then as an obligation, as a lab or as a health facility, duty to uphold evidence-based care. And in evidence-based care for the lab, the good clinical laboratory practices. Okay, so that is what the obligation that you are, the bill is coming up with, that we comply with. When it comes to safety and risk management, the issues around IPC measures and risk assessment and audits, they are now being made obligatory, not a matter of you do it when you feel like. Okay, we'll explain how that comes. And then when it comes to patient safety and quality assurance, now it is now becoming, first of all, that as an enterprise, you must have a professional indemnity cover for the professionals. That has always been there, but now for the enterprise. So the duty of care as a matter of obligation is now also extended to the enterprise itself. So as a lab, that one is being reinforced. And when it comes to QI programs, it is now obligatory that as a lab, you must enroll or register on a QI program. For example, Mwangi, you mentioned the 25-year-old journey. And up to now, it's people or labs, enterprises enroll on the EQA programs when they feel like. Is it so? Sure. That's what the practice is currently. But now the bill is saying that it's now a statutory obligation. So those are obligatory issues that we need to comply with. And then when it comes to employee competency and training, it also becomes obligatory that as an enterprise or a health facility, and a health facility here I'm speaking, I mean a lab now. Okay? So you must, as a matter of obligation, statutory obligations, enroll on that. For non-compliance, the penalties are there. It ranges from 10 million to 50 million bob. Okay? So when you speak into the bill, there are various components that the penalty is a 10 million bob or a 5 million bob or a 50 up to 50 million bob. So that is what is in the draft bill. And then at the top left, there are three actions: registration, licensing, and accreditation. So there's an authority that the bill is creating that is supposed to handle that for the health facility. Okay, so now that is the first takeaway home. The next takeaway home will come in the last slide. So as an enterprise, so it lays out responsibilities for the enterprise. Now the health facility here, that is the lab. So these are responsibilities that the lab is supposed to basically accomplish. you are supposed to fulfill these responsibilities. I'll not read word by word, but and I believe that these this material will be shared. I believe the material will be shared, so I'll not read word by word, but I'll just pick key things. Patient safety and quality assurance measures. As an enterprise or as a lab, it is expected that you you establish measures for that. And then ensure that whoever is working in the lab is duly qualified to provide or to work within that scope of practice that you've employed them to do. And that you meet the quality of healthcare standards. So this bill is speaking on a quality of healthcare standards for every practice. So for example, for a lab, we know, let's say, whatever the scope of lab as per what the category of the lab and the scope, the standards of care in matters of good clinical and laboratory practices, those will be defined, and as a lab, you're supposed to meet that. And then the last part, as an enterprise, you are expected to keep records of the inspections and mitigations measures that you are having. It's not mandatory right now. We do it as we wish, but now it's becoming obligatory. As an enterprise, the responsibility to ensure that risk management within the lab or within the health facility is established. Measures, you have to establish measures and implement measures for risk management within the health facility. That is the lab that you are running or that you are superintending. So that is what that bill says. And all these, for example, the bit of reporting adverse medical events and public health incidences, it's now obligatory. Implement procedures for detecting and reducing health risk and adverse events. So as the current space, labs are at various levels of implementing these measures. We implement this whenever we feel like, and that is what happens within the health facilities or the health enterprises as at now. But now the bill is saying that these are now obligatory, and measures, you must demonstrate that you have established the measures and you have documentations to show what you are doing with regards to that. And then still on enterprise responsibility, we know not every lab out there does annual audits, for example, and surveillance. Not every lab does it. But now it's a responsibility for that enterprise, for that health facility. And it says that all those reports must be made annually, documented, and submitted to the authority that this bill creates. And also, it's all becoming part of an obligation of the employees or the healthcare providers within the enterprise or within the health facility. Quality improvement programs, the one that I talked about. So you must, as a lab, ensure that you are enrolled on a quality improvement program and ensure that your providers or staff are well capacitated to enable them perform within those established roles, and ensure that we comply with the regulatory standards and quality of care standards that are established for the scope of practice within that lab or within that for the level of the health facility. And then in terms of regulations, the key three things that I listed in red: registration, licensing, and accreditation. The bill is creating an authority that now registers and licenses and accredits the health facility. And that is what it's called, the Quality Healthcare Patient Safety Authority. So that authority, that's what the bill is creating or establishing. And the roles that the authority has, one is to regulate and guide the development of health facility infrastructure. Remember, it has defined even an ambulance as a health facility. So even the design of an ambulance or what can come up or can pass for an ambulance will be defined. What can stand up as a lab will be defined as a health facility. What stands up as a hospital or a health center will be defined as per that in terms of infrastructure. In terms of registration and licenses and accreditation, this is the authority that the bill is establishing to license, register, and regulate the authorities. So in the last takeaway, in the last slide that we'll be talking about the takeaway, we'll see how this one marries with that. It is this authority that now comes in, one, also to develop the quality standards, okay, and put them out there, ensure that public awareness is raised and everyone else is adhering to what standards that have been established, whether at various levels that they are practicing, whether it is a standalone lab or it's a lab nested within the health facility. That is what now the bill is coming. And also this is the authority that is given the mandate now to advise the ministry structure, the CES and the PS and the DG Health on matters regulations for the health facility. Still on the authority, so this authority, just as other authorities, it is going to have a board and it's going to function with committees. And from time to time, the committees can co-opt members with various expertise regarding, depending on the matters that the authority will be executing at that time or the committees will be executing at that time. So that is just standard across maybe other government bodies. So this is basically the bulk of what the authority is going to do: registration, licensing, and accreditation of the health facility. So if the lab is a health facility, the registration of the lab, the licensing of the lab, and the accreditation of the lab now is being moved to this authority from whichever spaces that they've been currently. Because the current practice, we know that is a function that is being handled by KMLTTB. Yes? So that is what the current practice is. KMLTTB and KMPDC, they co-share this function, depending on the type of labs and the level and whoever the proprietor of the lab is. And then this authority is the one that now shall regulate and monitor the implementations of all the quality of care standards that has been established for each and every health facility or each and every health enterprise. So when you want to establish a lab or you want to establish a health facility, this is the authority that you make the application to. So that is what the bill is proposing. It talks of investigations, inspections, and enforcement. So the authority that is being proposed in the bill is the one that will be inspecting the health facilities, and the health facility here now for us, now the lab, it will be now investigating incidences or issues that are coming up with regards to patient safety and quality within the health facility, and also enforcing the regulations within the health facility. So that is the role that is coming. And with that, it also envisages that this work shall be done with inspectors. And the authority here is guided that annually the authority shall publish its inspection calendar and the inspectors and the code of conduct for inspection. So that is what the bill is saying. And then for the purpose of recourse, the bill is establishing a healthcare tribunal. In the current space, we have the HIV and AIDS tribunal, and it's limited to matters HIV and AIDS issues only. But now within the ministry or within the space also, each and every unit or agency have their own tribunal units. For example, the SHA, Social Health Authority, has their own tribunal committee that on matters claims management or SHA reimbursement as a health facility, when you feel aggrieved, you go to that. But now the bill is now collapsing or merging those tribunals into one, the healthcare tribunal. So any issue that the health facility or the healthcare enterprise feels aggrieved, now this is the tribunal they go to. One, for dispute resolution between the parties, and the timelines are given. So the tribunal may uphold, reverse, or revoke. For example, if the inspectors from the authority come to your enterprise or the lab, they make an inspection and they deem that 1, 2, 3 should be suspended or should be revoked, the enterprise has the leeway to seek reprieve from the tribunal. So that is why this tribunal is here. And when if you are dissatisfied with what the tribunal has said, the next level of recourse is now the High Court. So that is what that tribunal comes in to do between the health facility and the authority. I chose to speak onto this. The bill calls them consequential amendments. Here, it means that being that the bill is creating some new functions and some new roles, it is going to take up roles from other regulators who have been there. So as a consequence, some of those functions or roles are being deleted or amended. So that is what this means. So for example, for the Quality Healthcare and Patient Safety Authority, in terms of regulations, it is deleting the word authority and regulatory bodies, because now it's becoming one authority and it's been replaced by the Quality and Healthcare Patient Safety Authority. That is one from the Health Act. And then when it comes to the HIV/AIDS, that is the tribunal that now it's being merged. When it comes to KMLTTB and any other regulator that has been regulating health facilities, KMLTTB has been registering labs. KMLTTB has been inspecting labs. Okay? So when it comes to those roles, if you read the KMLTTB Act, those articles are now being transferred over to the Quality Healthcare Bill. And that is why if you read it, it says deleting the words where the business or the practice or the enterprise or the facility is mentioned in KMLTTB. Now those roles are being brought to the authority that this bill is creating. So that is what it means there. And it happens so across every regulator that regulates any health facility. For KMPDC, the roles or the functions where they register, regulate, and inspect hospitals or health facilities, those ones are also being deleted or repealed. The same to KMLTTB Act, the same to the Nursing and the Midwifery Act, and the same to Clinical Officers Act. So that is what the consequential amendments mean. So for this, I just chose to speak on KMLTTB. So that is what it means. This is the next takeaway home. You can forget all those, but this one and the first one, this is the next takeaway home. I had two. So when you look at what's happening in the global practice, this is just an example of what is happening in the global practice. We've got our country, Kenya, and in the practice of patient safety and quality improvement, we usually look at it from these 4 P's. We have the professional, that is the lab scientist that is working in that lab, or the clinical officer working in that hospital, or the medical officer working in that hospital. That is the professional. And the regulator of the professional, that's where we have. And then we have the practice. The practice of medical lab is the domain of AKM, MLSO. That is what is there. And then co-shared with the KACP, Kenya Association of Clinical Pathologists. Okay? So when you look at what happens, for the products, we have PPB. Every device or every product that comes into the country, the regulator is one, PPB. And we are well aligned with that. When it comes to the standards, generation of standards, nationally we have Qhps relating with the relationship with the ISO bodies and the rest for the standards that we have in the country. For accreditation, that is how accreditation has been spanning out. And I highlighted KNAS because KNAS has been doing the bulk of accreditation services for the laboratory practice. Okay, that is in country. But in country, for the health facility, the hospital, we've not had an accreditor in country for health facility and services. Most health facilities run to COSASA, and some run to JCI, and some run to SafeCare. SafeCare is coming up nicely. So sometimes back the ministry started something called KQMH. The intention or the ideal would have been that KQMH would have grown to an accreditation standard, just like JCI and COSASA, but it's still. So what KQMH missed was the body to house it. Okay? So now looking across the premise, the health facility, if you look at the global practice, is that the health facility is regulated by a different entity. In South Africa, they call it the Office of Health Standards and Compliance. It regulates the health facilities only. Anything called a health facility. In Ghana, they call the Health Facilities Regulatory Agency. This is the one that registers, licenses, and regulates the conduct of the practice of health facilities. And the health facility here now, we are speaking for the lab as a health facility. In the UK, the Care Quality Commission is the one that regulates, registers, and regulates quality within the health facilities. And in Australia, they have an Australia Commission for Safety and Quality in Healthcare Commission for health facilities alone. So if you look at that global picture, what has been happening in Kenya is fairly similar to what is happening in Nigeria, where the equivalent of KMLTTB registers and regulates the health facility, that is the laboratory here. So that is what has also been happening in Kenya, where the KMLTTB and KMPDC registers and regulates the enterprise or the premise that we call a laboratory or we call a health center or a health facility. So that is what the practice has been in Kenya and fairly similar to Nigeria. But the global practice is moving away to ensure that the premise is regulated separately from the professional. So that is the other takeaway home. So this bill, with the creation of the Quality Healthcare Patient Safety Authority, the intention is that with the premise or the health facility is moved out from the professional regulatory bodies, so that the professional regulatory bodies basically should have now more or ample time to regulate the professionals within the space. That was the next takeaway home. These are my thoughts. In terms of the patient rights, when you read through the bill, just ask yourself, has it sufficiently handled patients' rights? When it comes to the enterprise responsibility, the health facility, the lab here, ask yourself, is it going to increase cost of care? What are the cost implications of that? Especially now, I had alluded to some penalties over there and stuff like that. When it comes to the regulator, the Quality and Healthcare Patient Safety Authority has been given 3 roles: to register, license, and accredit. And my thinking, are this too much? Because by global practice, uh, if you have a too powerful regulator, it also muddies the water. And for Kenyans, we remember the previous practice where NHIF would inspect you, accredit you, and empanel you, and pay you at the same time. So we had that experience. So the payer should be different from the one who regulates quality and inspects you, so that these responsibilities are well spread out. For example, the current practice where KENAS plays the accreditation role is fairly well balanced with the regulator that registers the lab. The accreditation now is on a different scale. KENAS comes on board. And even at KENAS works with conformity assessment bodies and with its we call them assessors, trained assessors. So you find that there's a fairly well balanced separation of roles. And then when you read the bill, in terms of patient safety also and quality improvement, the issues around the enterprise responsibility for ensuring safety of the healthcare worker, the laboratory scientist in that lab, his safety has not really been spoken so much within that lab, within the bill. So in my considered positions and contributions, I would think we need to reconsider that, yes, the authority can register, license, and regulate the enterprises, but accreditation ought to be moved to a third-party entity. And the standards, when the standards are being developed, the regulators and the stakeholders needs to be part and parcel of the development process. In the global practice, the regulators, for example, KMLTTB, will be part and parcel of the development of the standards. But regulating the standards now moves from their desk to someone else, to another entity. And then in terms of regulating the care provisions, it therefore means that a competency framework should be developed for the healthcare enterprise or the health facility. The same way the regulators have a competency framework for the professional. For a lab scientist, there's a set of competency units or areas that makes you competent to practice in a lab. The same way for the health facility, we should have a robust or a fairly well-aligned competency framework for patient safety and quality. And then patient safety and incident investigations. By global practice, incidence investigations are also given to a third-party entity. Whoever regulates quality of care issues should not be the same one that investigates incidences. And I think the most recent example that we had with issues around kidney transplants in Eldoret, okay? We find that we should be moving away from instances where if we have an incident, a committee is put in place to investigate and it is disbanded. We should have a special purpose unit that over time builds its expertise. Over time, what the team at HUCAS has done for the last 25 years cannot be done with a purpose-put committee. Is that not so, Mr. Mwangi? What you've done over the 25 years cannot be executed by a committee put in to work for 6 months and be disbanded. So that is why even for patient safety and investigation, the global practice is that have a body, build its capacity over time so that maybe 10, 15 years or so, it becomes an expert in terms of patient incident investigations and providing, let's say, an impartial assessment or recommendations with regards to patient safety and and concerns. So on the penalties, the penalties, when I read the bill, they are fairly on the higher side, and with the mantra of ensuring culture of blame-free culture, we do not want to see punitive penalties coming around. So that is an area also that, as stakeholders in the practice, we should keep an eye on and try and see how we remedy them. So those are my thoughts around that. So you can, as you read through, you can always also have your thoughts and match them together. So that is just something for us at systems evaluation. Believe in better health systems equal better care outcomes, and that is just something that we are doing to get boards and healthcare executives ready to govern for patient safety. So that's one of our workshops that is coming up in October. Yes, for board members and the executives. So as a lab, as a health facility, your board members, your executives, not every one of those board members always have a background in healthcare. And everyone, when they come on board for the health facility, they need to be activated to govern effectively for patient safety and quality improvement. I've really tried to narrow it down. This bill is about 75, 76 pages or so. So I tried not to read word by word, but give key highlights on what you need to look out for when you ultimately sit down to read it by yourself, or when you go back to reading it.